A very good morning, everyone. Welcome to today's webinar hosted by the National Autism Resource Center at NARC. Thank you all for taking time out and being here today. My name is Vanessa Angel, and it is my pleasure to be the MC for this webinar. Just to inform our new audience, NARC is a one-stop repository and reference resource for anything related to people with autism, PWA, in Malaysia, including research. This is the first webinar for this year, and we will bring you two experts in child oral care, more specifically, oral care for special needs child. If you have any questions during the presentation, just write them in the chat box or the Q&A box. Both the speakers will answer the questions at the end of the session. For today's webinar, we will be having two guest speakers. Now, I will briefly introduce to you our first guest speaker. Her name is Associate Professor Dr. Mas Suryalis Ahmad. She graduated with a Bachelor of Dental Surgery from the University of Malaya, Malaysia in 2006, followed by Doctor of Clinical Dentistry and Doctor of Philosophy degrees in Special Needs Dentistry from the University of Melbourne, Australia in 2016. Dr. Mas currently practices special needs dentistry at the Special Care Dentistry Specialist Clinic at UITM Dental Center, providing treatment to adolescents, adults, and elderly with disabilities and various medical conditions. She also teaches special needs dentistry at the Faculty of Dentistry UITM and many universities across Malaysia and Southeast Asia. For our second speaker, her name is Dr. Ilham Wan Mokhtar, and she's a senior lecturer and specialist in pediatric dentistry and special care at the Faculty of Dentistry in UITM Sungai Buloh campus. She received her bachelor degree in dental surgery from University of Malaya Kuala Lumpur and later pursued her clinical specialist training at Ghent University, Belgium, after serving the Ministry of Health Malaysia for 2 years. She is well trained in managing children with special needs during dental treatment, oral health promotion for children with special needs, and oral health education. Now, ladies and gentlemen, please welcome our first guest speaker, Associate Professor Dr. Mas Suryalis Ahmad.
Okay, can you see my slide?
Sure, we can see. Okay, I think you can start, Doctor. Thank you very much.
Okay. Assalamualaikum warahmatullahi wabarakatuh and a very good morning to all. On behalf of Dr. Mas and the speaker side, I'm sorry for the technical glitch. We did have our practice just about 15 minutes before. However, things are outside of our hands when it comes to technologies. So I will start first. Actually, we have planned the presentation in a way that Dr. Mas has start first because there's a little bit introductions about our practices and our service center, which is our special needs centers that is very dear to our heart. However, I will do the second part first, and then we'll come back to Dr. Mas, and then we'll go into take questions at the end of the presentations. And I would like to take this opportunity from the NRAC, FSKM, and NASOM by inviting both of us to share, actually to a little bit, I might say share our practices and our services in Faculty of Dentistry mainly, and the way that we deal with special needs children, and especially in today's topics is ASD. So this is my first slides that really important to me, and where UITM has this tagline as a special mission university. Beside that being the biggest universities with 14 branches campus, we also have a very key interest in a specific important agenda in our countries, and special needs special needs populations have come across our specialty in a university per se, including FSKN as the committee that run the research and run the informations about NASO. So couples of other faculties is also doing the same work. All right. So my topic today will be oral health in children with autism spectrum disorders. It's going to be a very easy, straightforward topics for today. It's more of the sharing how I deal with children's, how I deal with my children's in my specialist center clinics. So the topics that I will be covered today is oral health concern in children with ASD. Actually, Dr. Mas supposed to cover the adults part, and I'll be covering the children. Because both of us with specialists. However, we both of us are covering two different end of populations. Dr. Mas cover adolescents to geriatrics, and I am majority with children. Okay, so we both are working in Faculty of Dentistry, and we do have two separate clinics, but we definitely work very closely. So when I finishes my children's, I will pass to Dr. Mas so that the patients will not lost in the systems, and it always be with us until when the times comes that they are can take care of themselves. Okay. So nonverbal signs, if your child is having a toothache, a little bit of sharing what are the signs and the body language that they usually portrays if they are actually in some of pain. Challenges in oral health care for children. This is more of the challenges in toothbrush. Okay, so I'm going to concentrate more of the toothbrush and toothbrushing activities for children with ASD. I do understand many of the parents who comes to me um, express, it's not complaining, express their concerns. So toothbrushing activities can be very challenging and very demanding for some ASD children. So I may have a little bit of tricks under my sleeves that I can share with some of you guys today. And at the end of the day, I'm going to share very quickly how our centers are providing dental treatment for children with ASD. Okay. All right. So we shall start with the oral health concern in children with ASD. Dr. Mas actually is going to go deep inside into these topics. I'm just going to show you briefly what are the oral health concerns or what are the oral health situations that we usually see in our ASD children's. Okay. So the first photo is actually very common. We call it gingivitis. It is actually an infection or inflammations of the gums, surrounding gums due to the plaque accumulations. Plaque is actually a food debris. When it stays there for a long period time, sufficient time to make it thick and very difficult to brush, it can affect the gum more than the teeth. So when it start affecting the gums can be swollen, and this what makes the brushing more agony. And the brushing, when they brush, it can cause bleeding. It's not bleeding definitely comes from the inflamed gingiva. Okay, the inflamed gums. All right. So the lower pictures here is I think the most common things that we see not only in ASD children, so also most of the children in the whole wide world is the caries. Okay, and the next one, the below one is the trauma. Trauma is also some of the major concerns that we usually see in children with the ASD because of their hyperactivities and the majority of ASD, they have a very high threshold pain threshold. So if they fall down, if they knock on something, they very seldom crying. So these are the things that usually happens to them. And most of the time we are at the upper hand to see all this trauma happens. And then the malocclusions is actually the alignment of the tooth is also can be disturbed and impaired. The middle one, I make it a little bit bigger because I think this is the highest issues that I usually receive from parents, which is drooling. They like to play with their salivas, and this can be also a very problematic in the children. Next, the lower one, which is bruxism. Bruxism is actually clenching or grinding your teeth, upper and lower teeth. To that extent, it becomes non-vital. It becomes dead on its own. When a child grinds, especially when they are in stress or they don't like certain things that are happening, or there is a changes of behavior or changes of routines, for example, they don't know how to express themselves, that they don't like it, or they are in stress, they can usually grind, and to one point it becomes very severe and unstoppable, and it can cause the tooth becomes dead on its own. All right. The next one is actually biting themselves. This is also one of our quite concern, especially when the new teeth comes out, or the changes when the permanent tooth are coming out and the deciduous tooth, the baby tooth are exfoliating, is going off. This is also some of the things that we usually see. They start to, as if in like teething, but not, teething like the first baby tooth. But when there's the changes of the dentitions, they also started to become agitated, and they might be biting on something, not maybe on themselves, maybe on something foreign body or something hard, just to get rid of the discomfort. The other one is actually this small boy here is eating crayons. We do also have patients who are, this is what we call pica, is actually eating something foreign, just to ease their um, their some of their behaviors. They do eat something. So this is also a certain things that we usually see inside patients' mouth. Dentitions on the anterior parts of the tooth because of biting something hard. Okay. So that's very quick on my side. Dr. Mas, I'm sure she will definitely explain more on that. So let's go to the next topic, which is the nonverbal signs that your child might having a toothache. Disclaimer, I might be wrong, I might be right, okay, but what I'm going to show you here is actually something that I observe, and me myself, we work very closely with OT and ST, especially with the FSK team, Dr. Kanan, Mr. Kanan and team. We do exchange notes and shares how the non-verbal signs that a child might show if they are actually having a toothache. Sometimes we don't know why the kids are throwing tantrum and showing some disruptive behaviors. We might start to looking inside their mouth, maybe they are actually having a toothache. All right. So first, if they were started to hurting themselves, for example, starting to pulling their hairs, or starting to, hit their body, things like that. Okay. If not themselves, they started to hitting others, especially the siblings. They started to hitting parents, mama. They can also have mood change. Maybe they usually, like in the morning, some of the light sleepers, the morning sleepers, perhaps morning is okay. Then when they started to wake up, there's no change of mood, for example. Okay, or they started to become agitated easily, or they're always angry all the time. So you might need to check whether they are actually having pain. Because to have a toothache, to have the pain, very sharp pain, then you feel the pain. Okay, even as a normal people, we need to get the cavities very big, then we started to feel pain. So for ASD, where the pain threshold is very high, the pain has to be very painful. That's why they started to have this kind of changes. Okay, so they might be starting biting, if it's not themselves, they started to biting others, and always hands is the easiest targets. But I do have some patients who actually biting their lips, and started to biting their tongues, just to get rid of the pain, the other pain, because we have also referred pain. So when they have a pain, for example, on the left side, they started to do something on the right side to get rid of the pain from the left to the other parts of the body. That also can happen. Okay. Next one is isolation. If you see that your child started to isolate themselves more, or this is something, a new behavior, for example, you also want to check their mouth. Passive aggressive, like for example, suddenly they are okay. They were okay. Suddenly they started to become angry with no reasons. After you rule out other things, that for example, even though they are still with their gadgets, or even though they are still doing the things that they like, or but yet again they are still showing some aggressiveness. you might need to check whether they are having any pain or not. Next is long crying, non-stop crying, I might say. This is also something that we usually see. And tantrum. I think this is one of quite numbers of my children comes to me, and then parents started to say that they are throwing tantrums sometimes for no reason. It can be something else, but in a perspective of dentistry, we always try to rule out something pain inside their mouth, because that's not something that you can see. Like when you fall down, you can see all the bruisings, you can see all the scars. But if the pain is coming from the inside, you definitely have to put a little bit on effort to see inside the mouth. Okay, so when they have come to this extent, the pain or the abscess is already taken place, and the pain has come to the threshold where they can actually feel it. Okay, and banging their head on hard surfaces. I do also have some patients who come to me and complain about this. Okay, so there are actually couples of non-verbal signs that I observe, and together with the parents who comes to me and um, they'll express their concern, as well as whenever Otis calls me during their session or therapy, they do have this kind of behavior. So they do refer the children to me to see whether is there anything happening inside the mouth. Okay. So the next is the challenges in toothbrushing for children with ASD. So for all these reasons, of course, as a dentist, I will definitely talk more on toothbrushings. I know it's a very difficult, challenging, there's a lots of barriers and agony of doing these activities with ASD children. But there's nothing, for me, there's nothing cannot do. Something that we cannot do. There's always things that we can do. That's my I mean, I believe in that. So I do empower and give awareness to the parents who comes to see me with their children. What are the things that we can do at home and within our own convenient time to at least alleviate their pains and their miseries. So for that reasons, we have to understand first what is actually the problems when we come to ASD children's. What is the problems when we want to do brushing? So I usually ask the parents first before we go to the solutions. We have to understand what can they do, what cannot they do. Okay. So the first photos is actually just merely they don't want to open their mouth. Okay, just simply don't want to open their mouth. So how to access the oral cavities? Say they also like to keep their food inside their mouth. Okay, instead of chewing it, directly swallow it. Sometimes they can keep it up to 30 minutes inside their mouth. So this is also not helping in the sense of oral health. Okay, next one, when we use toothpaste, they started to playing with it instead of actually brushing, and then they started to spitting it out or just play with it and make things more messy, and it's quite tiring. If we have to do activities, I understand, but maybe we can look into this. Okay, so the lower photos is actually cannot gargling. All right, I do understand many of the children's it's very difficult to gargle, sometimes to the extent of adolescents they still cannot gargle. Okay, photos, the child with the yellow jacket is actually just run away. Whenever you call abang, brushing time, they just run away, never to return. Okay, just simply run away. So if the child is small in size or maybe in a younger age, you can still catch them and then hug them tight and then try to force the toothbrushing. But when they already grows up and become taller than you, bigger than you, this is going to be very, very much of a challenge. Okay, so the lower one is the most common problems that I receive is actually you can put the toothbrush inside, but they started to bite it. So they just bite, just just to pull your leg, don't allow you to start brushing. Okay, so this is also a problem. And then spitting, they can all most of them also have a problems with spitting. So this problem spitting, this is actually more concern of a toothpaste, because most of the parents are quite concerned whether to use toothpaste or not to use toothpaste, because when the child cannot spit, most of the parents think that the bigger amount of the toothpaste will be swallowed by the kids, by the children inside. So this is also one of the things that we can discuss. Okay, And the lower photo is actually just crying and make things difficult, moving around, not putting best behavior, trying to run away from the activities. So I think this is one of the key and main challenges that the parents might face. You can share with me, parents, if there is a parents in the audience, you can share with me later on in the chat box what are actually the problems that you face during the brushing. You might agree with me, or perhaps you can give me a new other problems that you faced. Okay, so coming to this, okay, we have understand now the problem. So how can we solve the problems? Every problems have to have solutions. It's just a matter of time, or it's just a matter of how we deal with the problems. Okay, so we might not want to say the toothbrushing is a problem, okay, or oral health concern is a problem. It's just a challenges or barriers. So these are the ways I think we have to break the barriers and we have to overcome the challenges. All right, so toothbrushing activities, this is my suggestion. Most of the suggestion that I'll give to my children and the parents. Okay, so first and foremost, when you want to do brushing, you have to get started with the right paraphernalia, with the right equipment. Okay, so getting started, get the right toothbrush. Okay, is it hard bristle? Is it soft bristle? Some of ASD also comes with processing sensory disorders. Okay, where they have a very sensitive, especially the facial part and the lip. Okay, and some of the kids can really have a very sensory issues inside their mouth, especially the non-verbal ones. Okay, when they cannot speak, they cannot function with the tongues. I mean, they have less sensories inside their mouth. You are actually having a little bit challenges, more challenges than the verbal ones, because they just don't like textures. Okay, so bristles can be a very intimidating and a very annoying feelings for these groups. Okay, so that's why you definitely have to choose the right brush. Okay, if you go to the markets, to any Watson ke Guardians, there's an array of full of a stack of apa nama ni, toothbrush with a very different bristles. Now we are actually initially during previously we do have hard, medium and soft. However, nowadays I think in the market I've seen more of the soft bristles rather than the hard bristles, and there's still medium bristles. So try to choose. Perhaps you can buy all three types of bristles, okay, hard, medium, soft, and try first, but not to their tooth directly, but try to their body first. Because I do understand some of the parents do practice brushing, use a brush, and there's a specific comb, if I'm not mistaken, that the OT usually gives to these patients for them to brush their body. Okay, so we take this mechanism the same as to introduce them to the toothbrush. Okay, so you buy all three toothbrush, for example, you try all three on their body surfaces first, especially on the palm and at the back, at the top of your hands and at the palm. Okay, so try which one that they are actually can bear maybe minimally about 60 seconds. Okay, 1 minute, for example, you can brush along which one that they allow you to play around with their hands, then maybe that's the right brush for them. Then from the hands, you bring to the face. Bring brush to the face first. Okay. If they can tolerate it on their face, then you go slowly to the lip. Then later on, you goes inside the mouth. It can take up to 1 week or 2 weeks or perhaps 1 month just to introduce the toothbrush. But I think it's something that we have to start. Otherwise, toothbrush won't be something that they like to use. Okay. Then you can choose between the manual toothbrush or electronic toothbrush. It depends. Some kids really like the feelings of vibrations. They like this kind of feelings. Then you can use the vibrating toothbrush, okay, the electronic toothbrush, or you can use the manual if they don't like the vibration. Some kids are very sensitive to sounds, even though a very small sounds. So vibrations, electronic toothbrush do produce a little bit of humming sound. So I have to be careful on that. However, my personal practice, I do encourage parents to encourage children to use a manual toothbrush, not only for them to to get them to do it on their own, but to get their hands, the the round movement or the vertical movement of the hands, because when you use a manual toothbrush, you definitely have to work so much of your fingers and your hands. So this is also can help the ASD children's to have to build up on their kendiri and to build up on their sensory issues on the hands, and their palm grip, because most of them have a pincet grip, like holding a pen. So if they try to use a lot with brush, we can also practice with the hand grip. All right, so next is to get the optimum toothpaste. So this is actually a very straightforward photos. The above toothpaste amount is for the adults. The lower ones, the senior, is under 3 years old. And the over 3 years old, we use a pea size. So this is a very important when we discuss about the amount and about the challenge of spitting the toothpaste. The amount is a very small amount where, in my opinion, personally, I don't think it might cause any toxicity, even though you brush your child's brush every day with this right amount of toothpaste. Okay, the possibility that it got swallowed is very minute actually, because if you see the amount of the toothpaste on the toothbrush is such, and when they hits the tooth when it hits the tooth, most of them is going to go on the tooth surface. There's nothing much left actually, if the child really wants to swallow it, unless they manage to eat a toothpaste directly from the toothpaste tube. That is something different. Okay, so in my opinion, personally, I don't think we need to be worried about the amount of the toothpaste we used, if you use the right amount for them during the brushing. Okay, so this is something that I very much encourage for the children and for the parents, is a toothbrushing chain. What does it mean by this? Because perhaps your child is not, it's not, it can be somewhere in between these three photos. So for example, patients who are very severe, are very not well cooperated, instead of pushing them brush themselves, we can start with providing the toothbrushing for them first. Okay, so that they just, this is actually a very good practice, where just to introduce the texture and to introduce the activities to them. All right, so it's good if you can do toothbrushing, just you yourself provide, even though, like for example, your child is already 8 years old or 10 years old, suddenly they started to doesn't want to do brushing, you can always go back to provide the toothbrushing. It's not only to encourage back the texture and the activities, but it's also at the same time maintain the optimum oral hygiene. So these are the two things that we have to do actually. With brushings, it's not just only for them to practice and then accept toothbrushing, but it's actually the optimum oral health care that we need. So if the child cannot do it themselves, or they are giving you a little bit of challenge once in a while, we provide. Okay, so perhaps once in a week or during the weekend, whenever you have possible time, just have you can also play a role play with your child as a dentist and a patient. Okay, you become the operator, you become the dentist, and try to do this kind of activities. Then it really helps us when they comes to our clinics. They are quite actually familiar with what the activities of opening the mouth uh, for us. Okay, so after we provide, and then we move to assisted. All right, because in provide is actually to introduce the textures, to release the sensory issues, and when the times comes that the kids are well enough to start holding the toothbrush and bringing the toothbrush to their mouth, this when the chain started to move to the right side, where it becomes an assisted toothbrushing. Okay, so in these pictures, you do it together still with them, but you are holding their hands when they are actually doing the activities. Okay, until the end, and when it goes move to the right sides, when the patients are now more comfortable to do everything themselves, then this is actually the goal that we want to achieve. Okay, there's a certain circumstances, there's a possibility that it goes to the right, to the left side. Okay, but don't worry not, you always have to start again. There's always there is no there's no right or wrong, or there is no markah to be given. If you provide assisted self and then you go back to assisted provide, there's no wrong in that, in my opinion. But at the end, because at the end of the day, the goal of what we want to achieve is actually the oral optimum status too. Okay. So next, coming to the next, some of the solutions that I can suggest is actually the toothbrush modifications. We can do this, for example, if patients, a toothbrush only have one size of holding, the way that they hold. Okay, some parents, some patients, some children do have a little bit of sensory issues with their hands. They are very difficult to grip, especially hand grip, and most of them have a pincet, like a two-finger grip, like a pen grip, but they are challenged with the hand grip. So these are some of the modifications that I can suggest um, for parents to DIY at home and then try to elevate the activities. Okay, so the first photo is actually a bicycle handle. Okay, I just bought the bicycle handle from any DIY shops. You put it in and then put some plasticine or some gum gajah to make it stable. I do also encourage to buy the bicycle handles with some of the texture. So these textures can actually, encourage the sensories of their palm, and they can start it to, when they start to feel this texture, it might give them possibility for them to little bit push and brush their teeth. Okay. So the next one is towel, just a towel, a merely simple towel. Towel good morning also can, and then tied it up with the getah, okay, with a rubber band. All right, this is also one of the techniques. If you don't go to the idea is to get the right texture for your child. Okay, perhaps you can start with something very soft first, and then you go to something with texture. For example, you can also go with the tennis ball. Okay, I made a hole in the middle of the tennis ball. And the next two photos is actually a compound. This is like a plasticine material. All right, this is available in our clinic. This is actually a materials that we use to do dentures. Okay, the one of the dentures stages. But the idea is because this material can be moldable using only hot water. So when we put it into the hot water, it starts to become like a plasticine. So we can mold it based on the mold or based on the structure of that we need. So we can actually have the grips of our own children, okay, or the way that they want to hold the brush, we can estimate it. All right. Beside from that, you can also use plasticine to make it harder. You blow dry it with the hair dryer to get rid of the water, so the plasticines can become harder. So this also give a same outcome using this compound. Okay. So the next is actually a specific tools that I advise a lot in my clinic. Okay, so this is the first photo is a three-headed toothbrush. It calls Dr. Barman three-headed toothbrush. It's actually in the market, but it's quite difficult to get because of the demands. So the supplier said to me, it's very difficult to put in the market because there's no much of revenue. So they started to selling only to the dentist that is actually buying and then resell again to a specific patients. So I do have this in my clinic. So this is actually a very good, practicing. This is more of a training toothbrush, and the ones that is quite severe ones already have a problems that you do toothbrush. Okay, you already have a problems. So this is actually a good toothbrush for a training purposes because they have three headed. So when you put on the on the tooth surface, it covers all three surfaces. So you don't need to do depan dulu, belakang, depan, belakang, dalam. So it can be too much of an effort for an SD children. So if you have this kind of toothbrush, you can just put it on the one stroke. It covers all three surfaces at one time. You can also get this from Shopee. There's a lot of model. There's a lot of model from Shopee inside beside from this. So you can try and then implement it to the children's. Okay. In my clinic, we also do have we do lots of oral health educations. So this one Systema, I should not have like encouraged about the brand. I am no icon for any brands, but um, because these are actually in the market. So Systema, this one is actually vibrating at the one point. It's not rotating. The one with Oral-B is actually the rotating toothbrush. Okay, so the Systema is actually vibrating at the one point. So it's not moving left hand side. It just vibrates. Okay, so these are good tools that I use to train my childrens whenever they come to clinics. Before the next visit, they want to come for scaling. So I use this one first just to get the motions of the vibrating and the humming from the battery, so that when they come next visit to me to do polishing and scaling, they have this kind of ideas. And I do encourage parents to buy this and then practice it at home. So whenever they come and see me, there will be not much of a drama lah. Okay. The next one I also encourage because these children sometimes they have mood changes. Today they are not in a good mood, so they don't force. Maybe they don't want the tooth to be brushed, but the least that we can do is actually to brush the tongue. So this is actually a tongue scraper, the pink one, and the other one, the purple one, is the brush, tongue brush. Okay, so beside from teeth, actually most of the food, especially the sticky foods, and the patients who likes to keep the foods inside their mouth for a certain period of times, they have more problems on the tongues. They give this kind of order. Kita panggil halitosis. We call it halitosis. Even though there's no caries, but they always come with a crusted tongue. When you start to see the tongue like yellowish, whitish, started to become crusted, so we know that it's actually the food has stuck more on the tongue. Some of the parents also have a very, prominent papillae. The tongue is not, not as smooth. So they have more irregular and prominent papillae. So the food can easily get stuck there. All right. We see lots of in ASD also is a picky eater. They are very sensitive to certain texture and taste. So because I think this is one of the characteristic of the tongue that we see inside on these children. So not to forget the tongue too. If you cannot brush the tooth today, that's fine. Let's keep it for tomorrow. But perhaps you can try to brush the tongue today. Things like that. Okay. So the next one I'm going to share with you is actually the toothbrushing positions. After giving all these toothbrushing activities awareness, yes, parents have come and tell me, express their concerns. Yeah, I think I have all these toothbrush already, doctor, but it seems that it's just toothbrushing is impossible to do. Some of the parents and come to see me. It's just very difficult. They're just going to run away. They're just going to move this movement. They're just going just impossible. All right, so these are some of the concerns that the parents told me during my clinics. So these are some of the positions that I can advise. Okay, I share with you. So I do love wrapping. I do wrapping a lot, and I think I'm assured that most of parents are also do much of wrapping, especially when they want to give ubat, kan? When they are feverish, they want to give a Panadol. Some of the parents also do wrap, or maybe uh, do some korek telinga ke, ataupun potong rambut, this kind of activities that you need their attention at least more than 1 minute. I think wrapping is a way to go. So does to the toothbrushing. So I do wrap my patients, and I do advise the parents to wrap their patients. Just at least for 2 minutes, a good 2 minutes where you can perform the toothbrush optimally. So the first photos, you can wrap your kid and then put it on the chair. You come from behind. Always have the other hands. It depends on which hands. Are you right-handed or you're left-handed? So this is the way. The other hand has to be supporting your lower jaw. Okay? Otherwise, they keep coming down, because they definitely will bring the jaw down, because they always know how to run away from things. They always know how to run away from these activities. Okay, so we have to be smarter ahead, one step ahead from them. All right, so always have your the other hands to support the lower jaw so that you can see correctly, and always hold your lower chins to bring it so that you can eventually open the lower lip, and then the other hands where you have your toothbrush, you can start it working. All right. Okay, the next, you can do also on just on merely on the floor. All right, the way I sit down, a little bit open your feet. Okay, put them on your lap, same way, and then have one hands to support the jaw and the other hands to brush. The other one you can sit on a sofa or long sofa where these positions, and always remember one hand support, one hand brush. All right, next one. This can be also an activity during mandi, during their taking their showers. For people who have bathtub, this one techniques I learned from a parents. They put their child in a bathtub where they can, you know, start to playing bubbles, or they feel more secure in the bathtub. They like to mandi, take their shower in the bathtub. Take this opportunity to quickly brush their teeth. Okay, in this position. All right. You can also go into the bathtub. I mean, not with the water, just during the toothbrushing activities. Okay. And these the little ones, I do encourage patients, like for example, we just want to get them to not to move around. If the child is small enough, just get a baldi, okay, a pail, put them inside. Also fill up with the water to, you know, get rid of their attentions, play bubbles and put some ducks. At that point of time, you catch quickly, you brush their teeth, okay. And the other ideas that I can share with you, most of them are quite savvy with gadgets, and then they can actually become and then spend their attention on the gadget. So also take this opportunity to brush their teeth, okay. So but always remember, when you want to do brushing, one hand support, one hand brush, okay. Always have to support the jaw, bring it up, don't get it down, otherwise you can't see anything, and then you might started to hurt their teeth and the tongue. Then they become angry, they become anxious, and you become more angry. They started to spit on you, and then it becomes more messy. So the tip is always bring the chin up, okay. So the optimum toothbrushing that I can share with you, you always have to know how to work with your fingers, okay, because this is the only support that we have. All right. um, and we don't want to, force too much and give too much of exertion force to them, so that they feel that this toothbrushing is a very, hurting and no fun activities. Okay, so you have to know, always work with your hands, because your hands have the nice touch and the sensitive touch also that they need. Okay, so the first photos, when you want to brush the upper part, you have to make sure you lift up all the lip up, otherwise you can't see that properly, and then that would be not optimum. Instead of brushing the teeth, you might end up brushing the lip. And this part where you bring up the lip, there's a one we call it frenum, labial frenum here. If you don't lift it up, you might end up brushing that, and it's going to be very discomfort. Okay, you can try it on your own. If it's discomfort for you, it's going to be very more discomfort for them. So if you know what you are brushing, you have to see what you are brushing. Then I think the activity would be very optimum. Okay, so this is when you want to brush the upper part, and when you want to brush the lower part, again, the other hands, bring the chin down. Okay, when you bring the chin down, automatically the lower lip will go down together with your fingers, and it will expose a little bit of the lower teeth. So that also, there is a labial frenum on that lower there, so you have to be careful not to brush that instead. Okay, and the lower ones, you can also just bring the lip outwards. Okay, don't worry, you at this point of time your fingers are not going to be bitten, as long as your fingers is always touching the lip rather than bringing it inside. Okay, so now that is for the anterior, the front tooth. Now we go to the posterior tooth. To avoid your finger to get bitten, you have to make sure, you have to be careful. Okay, these activities also can be done using, if you want to wear gloves, that's fine. But most of the ASD kids doesn't like gloves because of the texture and the smell. Okay, so you definitely have to wash your hand properly. Okay, and then the first photos, if you want to go at the back lower or at the back upper, always use one finger, jari telunjuk, to lift up the lip. You have to lift up the lip. If you don't lift up the lip, you might brush something else, and it gives more pain. Instead of brushing the teeth, you might end up brushing the lip or brushing the inner cheek, something that you're not supposed to touch, things like that. Then things are going to be very difficult. Okay, so the key is actually you have to see what you brush. Okay, see clearly the optimum as you see. That's why some these activities also is a very good for the beginners. You can put a mirror in front of you, and while you are doing all these activities, you see what you are doing. So that's the kids is also what they are doing, so that they can replicate you, repetitions. By the times they are very stable enough to do for them to do themselves, they can always replicate what you have been practicing. Okay, they might be take couples of months, okay, I might say, but it's good that whatever you do, especially in brushing, you have to show them how, okay, so that they can replicate again. So this is for the lower teeth, this is for upper teeth. Always work with your jari telunjuk. And then if you want to brush on the upper on the occlusal surface, okay, this is the most important surface, two important surface in ASD, because they like to keep food inside their mouth. So our tepi ni, cheek pipi ni, like yeah, especially yang chubby cheeks tu, you have to really retract the cheek to make sure that there's no food trap there. Then the chewing part, the chewing the surface, the chewing surface of the tooth is also very important, not to forget. Okay. Good. So these are the other tips that I'm going to share with you. Is the toothbrushing modifications. I mean the activity itself. Okay, so for the parents who are actually having problems just to get your child to open their mouth, so these are some of the tricks that I shared with my with the children, with the parents. Okay, just get this is actually butter ice cream. You know, so today go buy lots of ice cream. Okay, collects all the batang, put it together until to the extent of it's like maybe 2 to 3 mm, maybe 4 mm, for example. Tied it up or glue it together. Okay, but make sure it's not doesn't go in the on the margin surface. So ikat dengan pun boleh, and then you balut dengan kain. So when you want to brush on the left side, for example, you put the batang on the left side, at the right side, vice versa. Okay, so this is, I mean, when we able to, we don't have, if they don't like it, if they don't feel like opening their mouth on that day, so we have to use something just to get the mouth open. Sometimes they just don't want it, not they are in pain. Okay, so we have to be slightly creative on to make that the mouth still open. Okay, the other way is this other photos is we use chopstick. Okay, chopstick, and then we balut, we wrap it with just some small kain, and then yet again tighten it up with the rubber band, and then do the same. So this is also a problem that we can solve if the kids don't know how to spit and gargle. I mean, to get rid of the debris of the toothpaste. So if you use a cloth and then you use a toothpaste, so this cloth is going to be able to absorb all the debris of the toothpaste. Okay, so two birds in one stone. All right. So after you just finish it, you just wash it or bilas dengan air, and then change it to the other side. You can also like soak it in like chlorhexidine, a mouthwash, for example, if the patient suffering from gingivitis, the first photo that I show you, the inflammations of the gums. So you just dip it in the chlorhexidine while you are doing brushing. The chlorhexidines from the cloth can give a little bit of reactions to the area where the gums is inflamed. But bear in mind, if the kids are very sensitive to taste, so you definitely have to choose the right mouthwash. If no mouthwash is working, guna air garam pun okay. Use a salt water. Okay. So I'm sure that parents are very well informed about these visual packs. Okay, we use a lot of visual help. So I do encourage parents who come to my clinic to take photos of my clinics. I mean, starting from the front door. This is also the visit dentist punya packs. Okay, the same. So take photos. The best is not to use a cartoonish photo. It's actually is the real photo. So you take the real photo of the toothbrush, your real tap water in the toilet, and your photo of your toothpaste, so that they can really relate to the packs. Okay, so I work very closely. I work very closely with the OTs. Okay, so they do help me doing this. So whenever they come to me, they are very well behaved and well understands about brushing. Okay, so I'm very in depth in my OT counterparts. They really help me a lot whenever I have problems with my patients who actually doesn't want to open their mouth and brush the teeth. We do refer cases to each other. Okay, so coming to the end, after all this awareness and sharing, so I want to go quickly about providing dental treatment for children with ASD. So in our centers, we are very privileged, and we are grateful to our dean. We are given a very specific. Later, Dr. Mas will share with you our clinics. I think one of the nice clinic, I might say, that we have, and we catered from zero to geriatrics. So we also have a pediatric dentistry departments that we work together, hands in hands, in treating any type of children with difficult disabilities, and we do have a lot. We do receive a lot of patients with ASD in our practices. Okay, so this is actually a very brief. I'm sorry to anybody who actually cannot understand Malay. So because this is actually one of the guidelines that I made in my clinic, so I did not manage to change it into English. So how we going to evaluate when you bring your child to us? First and foremost, definitely I will evaluate your abilities, your child abilities and disabilities, and especially the time, attention span. If the child can open their mouth for 5 to 10 minutes, for example, what are the treatments that we can provide? We can do scaling, we can do tampalan, we can do cabutan gigi susu, in fact, or cabutan gigi kekal, in fact, on the chair. But we have to understand first. For the first visits, we usually learn about your child first, okay? How long that they can sustain open their mouth, what are their dislikes, what are the things that they like, how can we communicate optimally with them, this sort of things, all right, before we proceed to what are the treatments that we can give. So if the patients can open 2 to 5 minutes, we can also do pencucian gigi, scaling, but instead of doing it in one go, we do it in 2 visits. So maybe first visit we do left side first, or upper and lower first, and then next visit we do on the other sides also can. And then we can do very easily on the anterior parts that can take nearly about 2 to 3 minutes. And then we can also do temporary fillings, and extraction of the deciduous is very quick. We can do very quickly within 2 to 5 minutes. Okay. So kalau boleh memberi kerjasama yang ringkas atau pendek 2 to 3 minutes, we still can do scaling. Okay, gradually, and all those things. 1 to 2 minutes, we can do cucian. Alright, and then cabutan gigi, we can do it in 1 to 2 minutes. Alright. But if tidak boleh memberi kerjasama kurang daripada 1 minit and with force, alright, and semua they need all the rawatan that I mentioned above, so we do have general anesthesia. Okay, so general anesthesia, we work very closely. We work together with our counterparts, Faculty of Medicine next door. We have Wat Bedah untuk oral surgery dan kanak-kanak, juga kanak-kanak keperluan khas. Okay, we have designated day for that. Then if you fall into this category and you have sufficient weight, for example, you don't have any other comorbidities, no extreme problems, we can definitely plan the general anesthesia under us. Okay. Beside that, teknik pengawalan tingkah laku that we usually use inside our clinics, if the kids can actually give their best behavior 5 to 10 minutes, we can use pengurusan tingkah laku biasa di klinik. We do have some tricks. We do tell show, feel and do, lots of we do voice control also, things that the normal ones that we usually use in the clinics. If it's not possible, we have a sedation, oral inhalation sedation. I'm going to show you the photo later. And then I'm very proud to say that I'm a use of a protective immobilization device. Okay, this I'm going to show you later on a photo about it. Alright, so this is a protective stabilization that I use in my clinic very often. I might say it on daily basis. Okay, it's a pappus board. This is actually, I think some of the OTs also use this technique to calm ASD children once in a while when they are having difficult days, just to get the hands and the upper part bodies, lower part bodies, because ASD are very strong. They are very strong child. So the upper part usually did not well cooperate when you want to do any dental treatment plan. So we have this So the pappus board is actually divided into three compartments, okay? Three compartments, the upper part, middle part, and the lower trunk. So some of the kids, we only have to, like, for example, wrap the upper parts, some middle parts, some all the parts. So it depends on the patient's cooperations and the on the treatments that we want to do at that point of time. Okay, so we do have this in our clinics. Next, nitrous oxide is oxygen inhalation sedations. Okay, this is actually a gas that we get the patients to inhale, just like in the photo. There's a nose hood, means that your child is not going to sleep, not going to be like fully sedated. No, they still can cry. They can still, most of the time they cry. They still can talk. They can still listen as normal. It's just that the gas, what the gas do is just to get the patient to calm a little bit, calm down, and then less movement, less aggressive movement. So they still can, like, you know, trying to get away with things. But when we put the hands together on the stomach, there's not much of a exertive behavior or the jerky movement. So this comes very handy when a child's mild to severe ones. Okay, they are quite cooperative, but they just not, you know, when we started doing some things, we cannot say, okay, hari ni kita nak cabut gigi. They don't really, you know, want to know that. Okay, so the less that they know, it's actually the better. All right, in my opinion. But when you started doing things like us, a normal people, we going to start to become agitated. So does them. All right, so these are nitrous oxygen inhalations help us in that sense. Okay, but if we were to use this and we have to do extraction, we still have to give local injection. Maknanya kena bagi injection lah untuk cabut gigi. Still have to give. Nah, this gas is not to get rid of the pain. No, this is just for calming effect and to reduce the jerky movements. Okay, we also do combine this gas with pappus board. Okay, so we put on the child on in pappus board as well and gas sedation to get an optimum less movement. All right, if something needs to be done, I mean abscess for example, patient come already with pain. All right, I mean I try my best not to send patient back with toothache whenever they come. So when we think that there's something need to be done, so we have to combine these two to get the the tooth extracted. Okay, so the most I think this is the for the major cases lah, okay, for the severe ones, and not only 1 to 2 teeth extraction. For I might say that if the child needs 5 extraction, 5 gigi nak kena cabut, we can do on chair. We don't have to go to general anesthesia. Okay, this is like huge job. If the child maybe 8 rotten teeth, and then they have like, we have to do root canal treatments and we have to do multiple things. We know that if we were to do on chair, the parents have to take lots of cuti, have to come 10 times, for example. This is going to affect the quality of life also. So in that sense, in this case, we're definitely going to decide to send the patients to general anesthesia instead of doing things on chair. But I'm a fan of doing things on chair because I really like to, you know, train the child to be able to be kendiri whenever they come to a dentist, because this is not a one-time visits. All right. My ambition is whenever when they grows up, when they come and see me in a child stage, for example 5 years old, I still want to see them when they are 15, when they are 25, and they be able to come to dentist not every time with struggles and drama. So this is my aim. So I do treat my patients more on dental chair rather than bringing them to general anesthesia. However, if cases that is a very complex, lots of food needs to be done, general anesthesia is the best. Okay. So my take-home message, this is going to be my few last slides. I always tell my parents, okay, the parents of my children, don't give up. We have to try again, okay? Work synergistically with the people around you. As much as you work with OT, you work with ST, you work with speech therapists, you work with physiotherapists, you also have to work together with the dentist to get the best treatment and the best solution for your child, okay? Let's just try again until one time we hit the right point where how we can treat the child. Usually I do spend at least 2 to 3 visits just to understand the child. Okay, when I know how to deal with the child, then I'll do the treatment. Sometimes it's very easy to read them. Sometimes they are very quite difficult. I do have to spend extra time. just to get to know their behaviors. Okay, so if you never try, you'll never know. All right, so this is actually a keratan surat khabar just come out very hari tu bila 2020 hari tu tapi baru keluar. So faculty pergigian UiTM has actually invest in special needs dentistry. So I am very grateful. I'm very happy. Me, Dr. Mas, and our team is actually trying to give more awareness and give to tell people outside that we are actually providing these services. So while we are so special, our clinics has been chosen to put on in the newspaper. So we are actually putting lots of effort in this special need dentistry. So everyone is welcome to our clinic. Okay, with that, I'll thank you. I'll pass the now presentations back to the Madam Moderator. Thank you.
Thank you so much, Dr. Ilham, for the informative tips on optimum toothbrushing and oral care for children with ASD. Next, let us welcome our second guest speaker, Associate Professor Dr. Mas Suyalis Ahmad.
Thank you very much. Okay, I'll try to share my presentation here. Everyone can see it? Yeah? Okay.
Yeah, we can see it now.
Okay, that's good. All right, okay. So I would like to say thank you to NARC and also to Prof. Liza for providing us this opportunity for us to reach out to our parents, teachers of those with autism, and it has always been our effort to increase awareness amongst Malaysian citizens and the public about the importance of oral health care, especially for people with disabilities, and in this case, those with Autism Spectrum Disorder. So this is me. Okay. Okay. Sorry, I just closed this. Okay, so this is me. So basically, I work very closely with Dr. Ilham. She specializes in children, whereas I specialize in adults and also old people. But we always discuss cases with each other. We refer patients to each other and also to other specialists in the faculty. So I am very proud to say that the special needs dentistry team in UiTM is a very strong team. We go all over Malaysia to speak to people and to conduct activities, and we hope to reach more people out there. And today, that's why we are very happy to receive this invitation. So this is where we are in Sungai Buloh. Okay, so right now, because of MCO, we only provide treatment for emergency cases. But of course, if you have any concerns, any emergency, you can come to the outpatient clinic, and I and Dr. Ilham will be there. I go there every day, despite MCO. So if there are any cases, we will go down and see the patients ourselves. Okay, so this is us. This is me, Dr. Ilham, Dr. Aminda and Azwin are on study leave, and we just had a recent addition, Dr. Ishraf, our only male dentist in our clinic. So in addition to patients with autism, we also treat other patients with disabilities, for example, those with Down syndrome, cerebral palsy, blind people, acute brain injury, people with any types of impairments, and also medical conditions. Like this one, this patient have hearing impairment, stroke patients, patients with Parkinson's, Alzheimer's, dementia. So we treat patients from age 0 to elderly. So that is a special thing about our clinic, is we treat patients across the age spectrum. And this is good to ensure that continuation of care among our patients. So this is some of the treatments that we provide. Of course, treatment in the dental chair. This is Dr. Ishraf treating patients using nitrous oxide machine here. This is me in the hospital ward. We are also called by our medical team to treat patients who are currently in the ward. Okay, and this is us in the operation theatre. And of course, if patients cannot come to us, we can go there and treat our patients, especially for our health promotion activities. Like in this case, we bring our students to centres, to pusat latihan dalam community, to special education school. We have been to Permata Kurnia and Kamara Centre for Children with Disabilities, and also other whatever invitations that we receive, we will try to fulfill. So this is our beautiful clinic. So the good thing about our clinic is that this is a specialized clinic. We have our own waiting area. So we understand the needs of patients with autism, where they have they can encounter sensory overload, where they cannot take too much of noises or people or interference. So we have our own dedicated waiting area, and this is actually a door for the patients to go straight into the dental clinic without having to mix around with other patients. So, and because this is a glass door, the parents can peep through this door to see what's happening inside. If they choose not to be inside, they can peep through this door. Okay, so so this is our clinic. So it is purpose built, okay, to accommodate patients with disability. So we have all these facilities, all these instruments to help people. Like, for example, this is a hoist to carry patients from wheelchair onto the dental chair. We also have the wheelchair tilt. So in terms of infrastructure, I am very proud of our clinic. So I begin my presentation today to highlight about why is oral healthcare important, especially to our patients who have autism. Okay, prevention is better than cure. I will always emphasize this to my patients. Although we have all the specialists and all the facilities, infrastructure to provide treatment for our patients, we always emphasize on preventative care, the daily oral hygiene care. And thank you, Dr. Ilham, for sharing all the tips and tricks in assisting our parents, our teachers on how they can guide patients with autism to exercise, toothbrushing, and daily oral hygiene care. And it is important to recognize that these patients, they are at high risk of developing oral diseases. And why is this? Is because difficulty in practicing and maintaining optimal oral hygiene care, because of difficulty in getting cooperation, compliance, and motivation. Some of them also experience motor deficit, where they have a delayed fine motor skills development. And as Dr. Ilham mentioned just now, some of them have difficulty gripping the toothbrush. So she has already mentioned ways on how you can actually modify toothbrush. What are the alternatives that you can use in order for them to undertake toothbrushing activities? And the other thing is because of drug-induced gingival overgrowth. Some of them experience epilepsy or seizure, so they are being prescribed with anti-epileptic medications, and it can cause side effects such as this. And when patients have gingival overgrowth, they are very scared to brush, because when they brush, it will bleed. So they will stop brushing. But then this gum overgrowth will become worsened. So we have to always emphasize on the importance of regular toothbrushing, okay? Because if they stop brushing because of this overgrowth and bleeding, the overgrowth can become even worse. So this can be controlled with good oral hygiene care. And if it's too severe, we will refer it to our gum specialist colleagues to have a surgery to remove this excessive tissue. Okay, but at the same time, patients still have to maintain good oral hygiene care. Otherwise, the gum can grow again. So the other thing is because the use of medications, syrup medication especially has high sugar content, and it can cause caries such as this. So caries can develop on the outside surface like this, or it can also happen on the tooth surface itself. So that's why Dr. Ilham emphasized so much on brushing on the tooth surface and also on the outer surface here, because this is where food tend to accumulate. Okay. The other thing about medication is that the side effects of medication. For example, some patients take risperidone or olanzapine for mood stabilizer. Some of them also take antidepressant, anti-anxiety, and these medications can cause dry mouth. And what can dry mouth cause? It can cause caries and gum disease, such as this. So this is caries. Gum disease, you can see this gum around the teeth is a bit reddish. Yeah, and also like bengkak, inflamed. Okay, patients can also get this dry red fissured tongue. So this is when Dr. Ilham emphasized on the importance of tongue brushing, because if the patient have fissured tongue like this, it is easy for the bacteria to harbor or to grow in between the lines here, and this can cause halitosis or odor, bad odor, or smelly breath. So that's why, in addition to toothbrushing, you should also encourage your child or whoever under your care to also brush and clean the tongue. Okay, oral ulcer can also happen because of dry mouth, and the other one is fungal infection that can happen because of dry mouth. So as I mentioned, some patients with autism also have epilepsy or seizure or sawan. So they are being prescribed with anti-epilepsy, and they can experience gum enlargement. And this can also cause their permanent teeth to delay in eruption. And the other side effects of anti-epilepsy is also low platelet, we call it thrombocytopenia, or leukopenia, which is low white blood cells. And when you have low platelet, there will be risk of bleeding. And when you have low white blood cells, there is risk of infection. So in order to at least reduce the risk of bleeding, especially when you get overgrowth gums like this, always make sure maintain oral hygiene care. Otherwise, the gum will continue to grow, and it can gingivitis can happen where the bleeding will become worse. Okay, and if you maintain good oral hygiene care, so there will be less probability for you to get oral infection. So the other thing about patients with autism is that Dr. Ilham has mentioned that they like to keep their foot in the pocket in between their cheek and their gums. So you can see if your child is like this, so there is a possibility that there is food there. They like to hold it there because it gives some kind of sensation that they like. So Dr. Ilham also has mentioned about how you can clean this area. So make sure when you do toothbrushing, make sure you clean this pocket area as well. So look at the patient inside the mouth, and look at not just the teeth, but also all over, especially that area, okay, in between the teeth and the cheek, because this is where the patients always like to keep their food. Okay, and the other thing about dietary habits among autism patients is snacking behavior, meaning that they like to eat food frequently throughout the day. Like most of us will only eat like 3 or 4 times a day: breakfast, lunch, dinner, tea and dinner. But for these patients, they like to eat like a bit and frequently throughout the day, and this can actually predispose them to developing problems such as caries or cavity, and also gum disease. Okay, patients with autism also is reported to have selective eating. Because of sensory hypersensitivity, they have high demands for low texture food. So some parents like to blend their food. So when patients eat blended food, it tends to stay in the mouth, okay, because it has low clearance. So when it stays in the mouth, it can cause problems such as caries and gum disease, and also bad breath, or bad odor breath. And of course, preference for sugary food, because when patients have dry mouth especially, and they have altered sensation or altered taste sensation, so they tend to put more sugar in their food, so this can predispose them to oral diseases. So the other thing is tongue thrust. Tongue thrust meaning that the patient like to push their tongue against the teeth. So when this happens, it can cause, we call it anterior open bite, where if you can see, there is actually a gap in front here. Okay, so when if your child or someone that you know have this anterior open bite, you have to go to two treatments, which is the oromotor myofacial therapy with a speech language pathologist, and at the same time you have to refer the patients to an orthodontist, because this can be corrected with an orthodontist or braces treatment. But at the same time, you also have to address the risk factor in this case, which is the tongue thrust habit. So that's why the therapy with the speech language pathologist is important. So in this case, the patient has undergone treatment with the therapist and also orthodontist. So this is the end result. Okay, the other thing about patients with autism is bruxism or tooth grinding behavior. And some patients actually presented with this. So meaning that they have all this tooth surface already being, they grind their teeth. So there's like loss of tooth surface here. Okay, so what happened here is that the dentist, in order to manage this condition, the dentist actually do a stainless steel crown here on the posterior teeth to open up the bite. So if the patient grind, it does not cause further loss of tooth surface. Yeah. So if your child or whoever you know actually have this condition, please refer to a dentist because it can be controlled. It can be managed. Okay, gastroesophageal reflux disease is also quite common in patients with autism, and this can cause dental erosion such as this, which is loss of tooth surface. Okay, and the other thing is, Dr. Ilham mentioned just now, they have very high pain threshold. So usually they do not notice that there is any oral disease, any problems, until it is too late, when the patients actually develop like swelling, when they become sick. So at the end stage, the more severe stage, only they come to us for dental treatment. So at that time, not much that we can do. If the patients are brought in earlier, maybe the tooth can be saved. But if it's at a very late stage and the tooth is not restorable anymore, it has very poor outcome. So then we have to then if the tooth has to go, the tooth has to go, and this can cause other problems later, such as malocclusion, or the teeth will become crooked. Patients will have problems with eating, with speaking, and also the self-esteem of the patient themselves. Okay, the other thing about autism patients is self-injurious behavior. So like knocking head, biting the tongue, chewing fingernails or foreign objects, and also self-extraction. And I think Dr. Ilham experienced a case during MCO where the patient actually pulled out the teeth himself because I think the tooth was already mobile and he was having some kind of discomfort, so he pulled out the tooth himself. So maybe Dr. Ilham can share the interesting case later. Okay, and self-injurious behavior can happen because of it's just their habit, or it can happen during a temper or tantrum, and some of them exhibit repetitive or self-stimulating behavior, such as arm flapping, rocking, head banging. So when they do this, accidents can happen and they can injure themselves, and it can also when they injure themselves, in this case it can involve their teeth and also their head. So epilepsy patient, if they have a seizure attack, then this can happen, such as this tooth fracture and also this injury on the lower lips here. Okay, or also they tend to bite their tongue, and some of them actually can have like their tongue can be cut quite bad. So like this, please bring your patients, your children or your loved ones to get emergency care, okay, because it can be treated. Even with tooth fracture like this, it can be treated. So please come and get dental treatment from your dentist as soon as you can. So this is a bite guard, which is used by some patients to stop biting when they develop seizure attack. Okay, I've seen this being prescribed. Dr. Ilham also prescribed a lot of this to her patients. Okay. And then patients with autism are prone to trauma and injury because of their disruption to routine. And this can especially happen during the MCO because during this time they have to stay at home, and it's different to what they usually do on a normal basis previously. So they can be distressed, and they can develop aggression and tantrum. And I'm sure you have read about stories. And for example, in this case, I've read this in the newspaper about parents sharing their how their children are actually coping with during the MCO period when there is actually disruption to normal routines. Okay. So patients, we still treat patients during this MCO, but of course there are challenges. Reduced access, meaning that I usually see my patients routinely, even though they don't currently have pain, but I see them on a regular basis. Why? Because I want them to be familiar with the environment. I want to make sure that they do not have they do not develop oral disease. So we see them more often to give that preventative care and to make sure that they maintain good oral hygiene, to make sure that they actually receive all this frequent reassurance about oral hygiene care. So during this MCO, we only treat emergency patients. So so we have reduced encounter with our patients. Some may need pharmacological intervention, which is also limited during this time, and some require management of multidisciplinary management, which may be limited during this time, and also the support system, because I understand that during this time is a challenging time for everyone. Parents or caregivers may have their own difficulties, financial difficulties, conflicts. So it is quite challenging for the support system as well. And this is how we look. So this is also a minus point, because when they see us like this, they become scared, because this is not the person that they used to know. Okay, because for patients with autism, they require familiarization, they require consistency. So when they come and see us like this, so they are not familiar, they don't know us anymore. So it's quite difficult for us to get that initial confidence and trust in them when we see the patients in the clinic dressed like this. So yeah. And there are also news all around the world, not just Malaysia, that during this time, it's a difficult time, especially for people with disabilities to get treatment, not just emergency, of course, that routine or regular dental care. And I believe that for all my patients, although they are not in pain, I have to see them, and emergency for patients with disability may not be emergency for other patients, but for me, everyone is important. Everyone requires that. Every one of my patients require that regular dental care. Okay, signs to look for to see whether your child or your loved ones are actually having some kind of oral problems, because 50% of patients with autism are non-verbal, so they cannot express that they are having problem or pain. So these are the signs to look for. Okay, bed wetting. Okay, meaning that when they sleep at night, so they wet their bed. They refuse to eat suddenly. Okay, because if they eat, then they have pain. They keep on pulling their face. Okay, because to show that that's the area that they are experiencing pain. Okay, some of them also have self-inflicted trauma or self-traumatizing behavior, like I mentioned just now, that pulling the teeth out. Okay, they become more socially withdrawn, and also they can develop behavioral changes. And what kind of behavioral changes is this? I have received concerns from parents that the child spits everywhere. So that might implicate that there is some kind of problems happening inside the mouth. And spitting is like a self-calming behavior, or like their escapism on how they can actually handle that pain in the mouth that they're having. Okay, increase aggressiveness. They refuse to eat. They avoid toothbrushing because when they brush on that part, it causes pain for them. And some of them also experience humming, laughing, or singing because of this hyper or hyposensitivity that can happen in patients with autism. So look for this signs. If they experience this, it might be a sign that your child, your loved ones might be having some kind of oral problems. So please come and bring your patients to us, or to your dentist, because we have to check, okay, in order to rule out that oral conditions. It might not be because of dental or oral health related problems, but at least we rule out any factors they may have caused that problem. So don't forget, come to your dentist if they experience one of these conditions. And I would also like to highlight that although it's just dental or oral health, it is actually very important to make sure that your general health and also the well-being is maintained, because there are so many studies out there which relates that if you have poor oral health, poor periodontal disease, gum disease, it can lead to other problems as well, such as diabetes, lung infection, bone problems, cancer, poor pregnancy outcomes for mothers, heart disease, and also there also event of stroke, which is related to patients having poor periodontal conditions. So always put your oral health also as a priority, even though it's just dental, but it is actually a very, very important component of your overall health. So please come and get regular dental care from your dentist. So okay, so that's it, my presentation for today. So is there any question from the floor? Okay.
Let us wait for the MC.
Okay.
We have
alright.
collected many questions. Vanessa will read it out.
Thank you so much, Associate Professor Dr. Masrialis, for the amazing info regarding ASD and oral health and the importance of dental care. Now it is the time for the Q&A session. Previously, our committee member has collected a few questions from the Q&A box. So now I will read all the questions given. The first question is from Amirah Ahmad. Her question is, I have an ASD teenage brother, 15 years old. He has a problem to move the toothbrush around his mouth and do not know how to spit out the excessive toothpaste. Is it okay for him if he just swallow the excessive toothpaste?
Thank you, Amira, for the question. I think I will take this question. He's 15 and he swallowed the toothpaste, right? If I get it correctly. I think as I mentioned earlier in my slides, I mean, it's very important the amount of the toothpaste you use. As long as you use the correct amount, the amount that swallowed is usually, when toothpaste like meddle inside the mouth and then get diluted with oral saliva, things like that, there's nothing much left actually. If really the your brother would swallow it, unless it's as I said, unless it he eats directly from a toothpaste. Tooth tube. Tube from the toothpaste. Okay. But yet again, because he's already 15 kan, I think if you were to use the toothpaste tu, mesti kena guna toothpaste because the toothpaste has fluoride and we need it to strengthen the tooth cavity, the tooth surfaces. But I might say that not to worry too much about swallowing it. But if you are very worried, maybe 2 times of brushing, 1 time you use toothpaste, maybe 1 time you use a smear. So we reduce the amount of the toothpaste, which is I'm not quite keen of. However, if your brother is really love to eat the toothpaste, so we just reduce the amount of the toothpaste rather than not to give toothpaste at all. I hope that answered the question, Amira.
Dr. Ilham, shall we also propose the use of child toothpaste? In this case, the 500 ppm toothpaste.
Okay, for adult, I'm not quite keen to reduce the ppm because I think we need that high concentration of fluoride to make the tooth strength because 15 years old, we are dealing with permanent tooth, no more a deciduous tooth. So permanent tooth needs sufficient amount of fluoride to be able to protect the tooth from caries. So I might not agree to suggest to use baby toothpaste with a lower ppm, but stick to the adults toothpaste. But maybe instead, the size, you can see that in my photos kan, dia ada satu dot, okay, and then tea size and then a smear. So maybe 1 time you use the right amount and then malam you use a smear just to reduce the amount. Yes, I agree, but not to use the lower ppm or the baby toothpaste. Okay, we can move to the next question.
And I think for this kind of patients, because their daily intake of fluoride can be compromised, so if we can actually do something more in terms of professional preventative care, meaning that they are given fluoride therapy. Yeah, so the fluoride therapy is conducted in the dental clinic by dentists, so it is more highly concentrated. So we do it about once a year on our patients. But for patients who are at high risk, we do it more often, even 6 monthly or maybe 3 or 4 monthly even, if the patient is at high or extreme risk. So please talk to your dentist. So your dentist may like to recommend on all this alternatives on how you can make sure that the patient is receiving adequate fluoride despite his swallowing of toothpaste behavior. So, okay.
Okay, now moving on to the next question. The first question is from Nor Awang. There are 2 questions from Nor Awang. The first question is, my child's teeth often bleeding. Is this due to lack of nutrition or bacteria in the mouth? And then the second question is, for disability kids, how often are dental checkups in a year?
Okay, thank you for the question. First is the bleeding problems. Most of the time, the bleedings comes, as I mentioned earlier, comes from the inflamed gingiva, okay, the inflamed gums, okay. So definitely we have to rule out the number one common problems of bleeding gums is actually plaque itself, okay, accumulation of plaque. When the plaques accumulated sufficient enough, long enough to make the gums inflamed and it becomes very soft and then becomes reddish. Things that inflamed are very prone to bleeds, kan? So when they brush, when you put a little bit of force, it started to bleed. So most of the time it's because of that gingivitis, we call it inflammations of the gums. But the questions of Puan is actually because ada anemia, ada apa dia cakap tadi? Because of other conditions, is it? So it can also be that kind, some I don't say that ASD don't have, I mean, some of the ASD do have any other underlying problems. Okay, so that's a very important things that we have to clear first. Clear the cause of any other underlying problems. For example, mungkin ada bleeding problems or anemia. Some kids do have anemia, and then the gums are very easily got brittles or easily very fragile. Nah? Bila kita brush, it easily bleeds. This is also other things that we have to uh, take into consideration. However, in terms of dentistry perspective, all right, in oral cavities, when we see, we definitely have to see the plaque accumulation first. We do plaque score. Okay, plaque is actually the number one cause of bleeding. I mean, the most common and the most easiest problems that we see. So definitely we are going to, eliminate all these factors first, and then definitely we have to work together. If the problem's persistent, then we definitely going to go into deep discussion about the medical conditions. Perhaps there is something underlying that cause the gums becomes easily bleeds or something else. And the next question of the visits, for the normal students, we is actually a very it has been a policy for the normal children to come visit as frequent as 6 monthly, okay, for the high caries rates patients, and yearly for the low caries risk patients. This is a normal case. However, speaking for children with special needs, okay, specifically for ASD, I would shorten up the period of visits. Maybe the first few years, I'll definitely would like to see my patients, my children as frequent as 3 monthly, until it becomes stable, so it becomes 6 monthly. And then once it becomes stable and things are quite in hand and parents can really practice properly oral hygiene at home, and there is no active caries within the first 6 months, within the 6 months, and then it becomes yearly. But for me, my regimes is actually 1 month, 3 monthly, 6 monthly, 1 monthly, until I think that both parents and children is actually cooperating well with the preventive regime that we have discussed. So that's my take on about reviewing the special needs patients. Dr. Mas, you want to add?
Yeah, basically the same as well. Once they have reached adulthood, they have to maintain a regular dental visit as well, because they might have different challenges as they grow up. And because of the risk factors that I mentioned just now, they are at high risk of developing oral diseases. So those who are at high risk, I will see them more often. Why? Because I want to make sure that before any problems happen, I have already managed that problem, or I've already done the preventative regimen before it progressed to a more complicated or more severe, or until it becomes an oral disease lah. So before oral disease even happen, we want to emphasize, we want to make sure that it is being treated early or managed early. So some patients, I'll see them even more often, and every time I see the patients, I will ask them about their how are they doing with their toothbrushing, their oral hygiene care, because if they're not doing well, then we can change our methods. So every single time they come, I check out on that toothbrushing regimen, because I always believe that preventative care is the best thing rather than having to treat. So
Doctor, Doctor, I think we have 15 more minutes left. I think we can go a bit faster. Okay, Vanessa, you can proceed with the next question.
Okay, for the next question is from Radi Bakar. Good afternoon, Dr. Ilham. For ASD children who having escaping behavior or refuse to attend the oral checkup, or the worst case, they throw fight to us. Based on your personal experience, is there any strategies you have applied when having this type of case? Could you share with us? Thank you.
Thank you, Vanessa. I think I've read this Mr. Radi's question on a private the private chat juga kan. I've answered this, but quickly I would say that yes, I use purpose board for all the escapers. Okay, even just as simple as to see their oral cavities. So I use that very often, the purpose board. So that is my my apa nama, special weapon. Okay, thank you.
Okay, for the next question is from Rosnita Osman. The question is, does electrical or auto booth toothbrush is good for children? Do they need supervision from parents while using this kind of toothbrush? Actually, as an adult, I don't prefer auto toothbrush as its vibration make me dizzy. Maybe the effects is different from one another.
Okay, Dr. Mas, you want to comment first?
Actually, for me, you have to see what works for you, because some patients, they like that vibrating sensation. Some patients do not like that vibrating sensation. So according to, if we want to look at the previous research for patients with disability, it has been found that the use of electronic toothbrush has been found to be more effective. But then I would again look at what kind of disability that the patients have. Is it because of they cannot hold the toothbrush, some kind of like manual dexterity problems, or is it just because of wrong techniques? So different patients are different. So I would say that I will do like a try and error method. So see whichever that suits that patient, and if the patient likes manual toothbrush, for example, so we can guide the patients on how they can actually perform effective toothbrushing with using manual toothbrush. Okay.
In my opinion, whatever you do in terms of brushing, the first few stages, first few phase, you have to supervise. Okay, just to get them to make sure that they are doing something correct and not hurting themselves, and not playing with the water, not eating the toothpaste, not biting the toothbrush, things like that. So in terms of the supervisor's note, you have to supervise, and I think most of the centers also supervise brushing until we can see that they are actually doing the things sufficiently, optimally. Then we can leave them on their own. On the notes of toothbrushing, electronic, as Dr. Mas mentioned, it depends on cases basis. Some kids do like the vibrations and the humming. Some kids doesn't like it. So there's always trying, and you see which one is suitable for your kids. If this is one is correct, then that's fine. There's nothing. There's no right or wrong of toothbrush that you want to use. However, bear in mind, if you want to use electronic toothbrush, you have to alternate with the manual ones, because if you keep using the electronic ones, you lose the manual dexterity of the kid, okay, of the child. We also want to keep that because of the comb hair, makan, mandi. So these risks. The risk that we use for toothbrushing is also for other things too. So I would suggest, if your child do like electronic toothbrush, please alternate it with manual toothbrush once in a while, just to maintain the manual dexterity. Okay, thank you. That's my point. Okay,
Okay, for the next question is from Faizul Adnan. Good afternoon. Is there any way to help kids, normal or ASD, with trauma or PTSD related to oral, mouth, or teeth during their childhood? Thank you.
So the child have PTSD because of trauma that they have from dental experience. Is that correct? Well, okay. PTSD, actually, only psychiatrists can clinically diagnose PTSD. Okay, so, but fear and anxiety and phobia does happen as a result of traumatizing experience in the dental clinic. Okay, so it does. I have encountered patients who develop fear, anxiety, and dental phobia because of their previous experience, and even then, this can actually be encountered lah. Okay, with some behavioral guidance strategy, and also I have also sent patients to. I've worked with psychologists to actually overcome this fear and anxiety towards dental treatment. So yes, I have seen patients with or without disabilities who actually have some bad experience with dental treatment previously, and then they have fear and anxiety. So in terms of PTSD, from my experience, from my knowledge from the literature, PTSD from dental treatment, So far, I have not encountered yet, because usually PTSD is more prevalent among rape victims or war veterans, because PTSD is such a strong word. So from my knowledge, not PTSD, but fear, anxiety, and phobia. Yes, it's quite common actually. So yeah, that's my comment.
Okay, moving on to the next questions from Tan TM. There are two questions. The first question is how to sign up my son for an oral checkup with these two esteemed doctors. My son doesn't have an OQU card. Will that be a problem? And then the second question is I get my son to use mouthwash after brushing his teeth. Is that advisable? Thank you.
Okay, if you would like to come and have treatment with us, you can call the hospital. The number is in the website. We have a special pathway for patients with autism, meaning that they don't have to go through the normal pathway like everybody else. The normal pathway is they come on an outpatient basis first and see a general dentist, and then they are being referred to us. But for patients with autism, patients with special needs, there is a special pathway where patients can directly contact us. So they don't have to go to the outpatient treatment clinic first. They can straight away be referred to us and attend our specialist clinic. So please call the general line. I can't remember the number. I think it's on the website. 61265000, if I'm not mistaken. Okay, so or you can contact an NARC after this. I can give the contact details to the NARC secretariat to be distributed to parents who are interested. Okay, what's the other question just now? Sorry.
The second question is I get my son to use mouthwash
Oh
after
yes,
brushing
okay.
his teeth. Is that advice?
Yeah. Okay. Actually, if you want to use mouthwash, especially those with this active ingredients called chlorhexidine mouthwash, please give 1 hour after you brush with fluoridated toothpaste. Why is this? Is because the active ingredients in fluoridated toothpaste and also the chlorhexidine in the mouthwash can deactivate each other. So we would encourage patients to to use the mouthwash 1 hour after the patients brush with fluoridated toothpaste. Yeah, 1 hour after.
Okay, moving on to the next question from Zafira Abdullah. Thank you, organizer and the panelists. How can we set clinic appointment?
I think I've answered just now. Can to call the general line, but it's okay. I will give the number to the NARC secretariat lah. If there is more direct number that they can call. Yeah. Or can I just add about the mouthwash just now? Actually, the use of mouthwash is not I don't condone the use of mouthwash to everybody. Okay. I only advise if they have some kind of gum problems. So even then, they only use mouthwash for 2 weeks, and then we assess again. If the oral hygiene is good, then the patients can stop using mouthwash. They don't have to use mouthwash every single day for the rest of their lives. So that's why I always have this frequent recall checkup with your dentist, because you can discuss on the use of the various products, including mouthwash, whether or not it's suitable for you, whether or not it's needed for your child. Dr. Ilham, do you have the number, the direct phone number to make appointments?
Yeah, I also don't have it, but usually you can come actually as a walk-in, but not now during MCO because we just received the emergency cases. You can come to because we do have on-calls every day, and I am in the on-call rotation. So whenever you bring your child to our faculty of dentistry in not Hospital Sungai Buloh, you have to go, let's say, further up. okay, we are in the faculty. So you go into outpatients, and then if it's a severe cases or something that needs to be seen immediately, we will come on the spot, or otherwise we will give you an appointment based on the conditions. I think that would be better rather than, because we keep changing our phone number and our assistant, so that it will be easier if you come as an outpatient first and be in the systems, easier for us to trace. Thank you.
Okay, thank you for the answer. And then for the next question is from Nur Fasiha. Good afternoon, doctor. Most kids are picky eaters. How do we help a child who is picky eater, and can this child have sensory issues or just behavior?
Thank you, Fasiha, for the questions. For picky eater, I started working with the dietitians how to improve and cater all these picky eaters, because first and foremost we have to understand why does these kids have these situations. Why do they pick? Is it because of the texture, because of the temperature? Is it because of the teeth? Because of, we have to acknowledge that one first. Okay, so once we have that, we work with our dietitians. They have this kind of food chaining as much as how the toothbrushing chaining. So I learned a lot from my new friends I made in UKM, dietitian Dr. Hana Hamzaid. She actually specialized in autistic children, who dietary in autistic children. Okay, maybe you can Google that about her. So I learned from her that there's also a food chaining that we can train. Okay, this is another ball game about picky eater. It can be, most of the time it's not dental related. It's more of the sensory issues related and the dietary itself. Okay, I think I better stop there in giving my comments. Otherwise, it's going to Madam Chairman will be very angry because we are actually running so much of time. Thank you.
Okay, this is the last question we can take. It is from Connie Yi. Thank you for the talk. Very informative and useful. Wish more carriers of ASD would tune in. My son is 22, ASD, and was advised to have four wisdom to be removed. Is it a must or just advisable?
I'll answer this live because it's adult
Okay.
patients. Actually, it's difficult for me to say because we have to look at the condition. So there are many factors to consider. I would rather not comment because yeah, there must be a reason why whatever treatment that we do, it has to be indicated, meaning that it has to be a reason why. So unless I see the patients and do the proper investigation, then I can comment. Okay, so well, you can always get second opinion, okay, if you are concerned or you do or disagree. So yeah, if you would like to get our opinion, you can come and see us. Yeah. So yeah, that's it.
Doctor, there is a question asking about the fee, which is there any discount for son of student for treatment? Is there any fee being charged to the patient that not related to your ATM staff or what?
Okay. All right. This is okay, very interesting answers. I'll try my best to give it, like, since we are on Facebook Live, I have to be very careful what I say. So we are very encouraged to all to all children or adults with disabilities to actually apply for OKU card. As long as you have OKU card and then you come to public facilities, including us, okay, because kita badan berkanun universities, you are still entitled to have a free of charge for most of the treatments, except if you have to do something with hospital related. For example, if you are to do GA, we do have a very small amount of fees that we impose in terms of bed, in terms of hospital settings. But however, the key is get the OKU card with you whenever you come seek your treatment for even to us or any public facilities. But I cannot answer for private sectors. They might have a different perspective. But for our faculty, the OKU card is the key card for you to come in and get as much as FOC treatment as possible. Thank you.
Well, it looks like we have answered all of your questions. Thank you, Dr. Mas, Siralis, and Dr. Ilham for your precious and valuable time and tips. I'm sure all of us, including today's audience, have gained a lot of information that will be beneficial to our future autistic children. Ladies and gentlemen, we have come to the end of our webinar for today. On behalf of our organizer, the National Autism Resource Center, NARC, we would like to extend our deepest appreciation and gratitude to all of our distinguished participants for being here with us today. See you again next week on 23rd January. We will bring you the topic Sexuality Issues for Children with ASD. Have a nice and stay safe. Thank you.
Thank you so much. Stay safe, everyone. Take care.
Thank you,
Ilham,
Doctor.
Ilham,
Please
stay.
please stay first.
Oh, Ilham, stay.
All of you stay first. Okay, thank you for all the participants. I think doctor can read. The doctor can read some of the comments, some of the thanks from the participants there. Okay, I think I can stop the session with the participants, and I will set the practice session with you. Okay, thank you all.